The DSM-5, the Diagnostic and Statistical Manual, published by the American Psychiatric Association, which is kind of like the Bible of psychiatry and contains all of the diagnoses and all of the inclusion criteria. The definition of ADHD that's in the DSM was changed slightly recently. It used to be that you needed to have symptoms start before the age of 7, even if you were an adult being diagnosed with ADHD for the first time. That was changed. Now it's a little older. Now you have to have symptoms before the age of 12. And what that does is it makes it more of an inclusive diagnosis, and more people who might have not qualified for it in the past now do qualify for it. The number of associated symptoms, and that's like the number of accompanying issues that come along with the diagnosis, like inattention, difficulty starting complex tasks, that went down from 6 to 5, which again kind of makes the number of people who qualify for having ADHD bigger. And another change that's outlined in the DSM is that they're recognizing the importance of getting quote unquote collateral information when making the diagnosis. So we can't just rely on what patients are telling us. We need to get other sources of information. We need to be looking at report cards. We need to be talking with family members. We need to be talking with coworkers. And without that kind of extra information, making that diagnosis is a little trickier. Um, in terms of treatment hasn't changed all that much. Uh, Psychostimulants are still the first line treatment. They're our gold standard. Time and time again, they're shown to be the most effective. There are non-stimulant options, but stimulants are generally considered the way to go at least at first. And there have been some new options recently approved. The FDA recently approved something called Quellbri for ADHD. This is a medication that actually kind of looks and acts closer to an antidepressant, but in young people can be very effective for ADHD as well. So one piece of advice that I'd share with other clinicians in recognizing and treating ADHD, I think that many clinicians I work with have some trepidation about prescribing a full psychostimulant because they're controlled substances and there's a concern about later developing an addiction.